Today we're going to discuss about doing tracheostomy care as well as tracheostomy suctioning. Again, both of your checklists are on WebCT. You'll be able to refer back to them as you do your practices for your checkoff. So I will be using those as my guide today to explain to you how to perform both of the skills. Basically, I'm going to give you a little background information, give you some something to start kind of working in the back of your mind, and then I'm going to give you a demonstration of both of them together. When it comes to tracheostomy care and suctioning, this is something that at the beginning of your shift, most likely you're going to perform both of them together, one after the other, of course. And then the suction is the one who you will be performing throughout your shift as needed. When we're looking into doing a trach care, you're going to do the same things that we have talked about before. You're going to do your assessment part. And again, you're going back into your nurse's report. You're going back to your medical history, the reason why the patient had a tracheostomy, how long they had it, any issues that you need to be aware of, nurses' notes prior to the one that you're going to be doing. So it can give you an idea or kind of a mental picture of what you're going to see in your patient's room when you go there. Next, you want to make sure that you have all the equipment that you need. And remember, this is a skill that you will need to perform a focus assessment. We already kind of talked a little bit about that. This time it's going to be mostly respiratory. So you are going to take with you the equipment that you need as well as the Dynamat machine, because you're going to need respiratory rate, heart rate, blood pressure, and pulse ox. So you need to make sure you take the pulse ox machine with you. If your client is already placing it on a monitor, you'll be able to see that on a continuous basis, and it's that's one less thing you got to bring with you. You want to make sure that you have at the bedside all the equipment. So you will come into your patient's room, you'll introduce yourself, verify your client, ask them to state their name, and then you're going to take a survey of the room. And what do you need to make sure that you have in the room? One is make sure that you have enough suction catheters at the bedside, that you have the trach care kits at the bedside, that you have plenty of inner cannulas. And let me say a thing about inner cannulas. This is something that you will see more and more in the hospital when the clients are placed on a tracheostomy. They're using a thing called disposable inner cannulas. This is what you're going to change on the client. You're not going to clean the inner cannula and then replace the same one. You will be changing. So the one that you're taking out, you're disposing in a red bag and you're replacing it with a clean one. Therefore, the patient should have at the bedside a box full of inner cannula of the right size. That's another thing that you want to make sure that you have and you know of your client, the size of the tracheostomy, as well as having an extra tracheostomy kit at the bedside with the patient's size. And you'll see the size right here, 7.0. Also, at the bedside, when you're looking into the equipment-wise, you want to make sure that you have suction, and then you check the suction that it's on the right level, anywhere from 80 to 100, 120. And you want to make sure that you actually check it to make sure that it works, that there's suction on the wall, that the client has working oxygen. Either if you need to bring an ambio bag with you so you can physically hyperoxygenate the client, or if the client is able to follow commands for you and actually hyperoxygenate themselves. Also, you want to make sure that you have what they call obturator. That's usually taped to the patient's wall in case there is accidental extubation during suctioning or cleaning. Then you place that until the physician comes in and place a new tracheostomy on your client. So you want to make sure that all that equipment is available to you and that is working before you go into the patient's room. Also, you want to go in, and as you do the survey of the room, you explain the procedure to the patient. Most likely by then they're already used to. For patients that have a new, freshly placed tracheostomy, they're going to be a little apprehensive. They might be a little bit in pain. So you need to make the determination, the clinical judgment, do I need to give this client something to calm them down, something for the pain, before I start, and I give them enough time for the medication to work before you go in there, okay? Also, if the patient is confused, that you have somebody to help you, because this is going to be uncomfortable. Remember, you're right here on the trachea, and this is a very sensitive area, and the patients are not going to be very happy about you putting a catheter down in there and suctioning. So you want to make sure that you have somebody with help. So now we're just going to pause for a second. I'm going to get everything together, and I'm going to give you a demonstration on how to do this. Okay, so I'm going to give you the demonstration on doing the trach suctioning and the TrachCare. One of the things I wanted to give you a visual is what I mentioned before, an obturator. This is the piece of equipment that I will be into a container that is sealed and is taped to the wall. This is the equipment that if the tracheostomy becomes dislodged and comes out, then that's the piece of equipment you'll put into the opening, the stoma. So it allows the stoma to remain open until the physician can come in. And of course, you have to stay with the patient and make sure you assess the respiratory status. So I just wanted to give you a visual for that. Okay, so you're coming into your patient's room now, and you're going to do your assessment on your client. My client, Mrs. Shapiro, is the lady who I mentioned before that she had the stroke, acute stroke, and that the right side is paralyzed. She has a tracheostomy, so she's connected to an oxygen source with a trach collar, and she's unable to communicate with me. So therefore, I anticipate that she's going to be anxious and she's going to be a little restless throughout the procedure. So I make sure that I bring somebody with me. So my CNA, Mrs. Faye, is going to be here helping me. One of the other things that we wanted to make sure is that as I am preparing my equipment, I am going to give her enough oxygen that's going to carry her through the procedure so she's not depleted. I have her connected to the monitor where it shows the heart rate and the pulse ox, and I can monitor that. Mrs. Faye right now is making sure, because she's getting the trach collar, she has humidification on her oxygen. We don't want that into an ambu bag. So you want to make sure that you have a source that you can connect directly into the ambu bag, and it can be used to give in high concentrations of oxygen, and that's exactly what she just did. So you want to make sure that you can direct her to get all that ready and start hyperoxygenating the patient while I'm getting my supplies and my equipment ready. So that's what she's going to do. I have her up high as she can tolerate it. I will ask her to please, if I can have my suction catheter, Miss Faye. And can you turn it on for me so I can just kind of give a little quick check? Put it around 80.
Okay, it is.
All right, you can feel it. You get the little suction in there, okay? And I have it very available to me, easy going. I have the rails down.
Mrs. Shapiro, I'm going to give you a few deep breaths with this special bag.
Putting the whole bed a little bit higher for me. Okay.
Okay, a few deep breaths.
While she does that, I am going to go ahead and get my equipment ready. I have my clean gloves, okay, because I'm going to be removing that the split gauze, and I'm going to show you that in a minute. I have my saline that I'm going to need. I have my suction kit. And I want to open it. And you already have done all these things in 11:15. You already taught how to open all these packages. So you're going to open it. We have the little reservoir for the water, for the saline right here. So you have to put it together, put it on the side. Again, all the things apply that you learned in 11:15. Label on your palm. If it's open, then you want to make sure that you lip it and you clean all the area around before you're going to pour it in there. And this is a new container that I'm opening, so I don't have to do that. All I have to do is make sure that this is up, and I am going to pour some of my saline, getting ready to go. Okay? And I am going to replace the cap. I'm going to put my clean gloves on for a second, because I'm going to do a little assessment. Notice that I haven't opened any of these packets, so it's not exposed in there. I'm going to check. I already had a baseline of heart rate, respiration, blood pressure, and pulse ox, as I mentioned before. And I listened to her lungs, and I'm going to do it one more time. Listen for a full cycle. And then I will turn it over to the side, or to ask her to lift up a little bit so I can listen to her lungs in the back. And I'll do that in all the anatomical places that I mentioned before. We'll do that. And she has a little bit of bronchi. I can hear a little bit of the secretions in the upper airway, so that's what we're going to remove. Okay? So I will look, and I will take this, the split gauze, We're going to take it out. And I'm going to take a look at it. I'm going to look at the secretions, the color, consistency, amount, any odor. And the way we discard, we put it in the palm of our hand. We wrap our glove in the other palm. And then we do the same thing we did before. And we put it on the red bag. Okay? So now we're going to wash our hands one more time before we start this. So you're going to open. And you have your gloves in there. Remember the 1-inch border and all the things you learned from 11:15. You put your first pair of gloves. And remember that if it's twisted, you just wait until you get the one. This thumb hitchhikes under the, come back out. Now you can fix it. You're still sterile above your waist. You grab your packet and you make sure that you expose the connector. And now my dominant hand, my sterile hand is going to be my right hand. My dirty hand is going to be my left hand. So I grab now my suction. I will make a connection, making sure that I don't touch both hands or the connector with the other hand. And then I will remove the packet. At the same time, I'm actually making sure that it doesn't get dirty. I'll check my suction. And you see, you clean a little bit of that catheter. Okay, there we go. So now, my assistant is hyperoxygenating my client. I'm looking at the vitals. Everything seems to be well. I'm looking at the color and the respirations of the client. And I'm going to tell them, now I'm going to go in. And you want to make sure that the tip of the catheter doesn't touch anything around. And I will tell my assistant every time she needs to remove it and replace it. My thumb is up. It's not putting pressure. It's not putting suction in it. Just up. And then I'm holding this with this hand. You're going to be going about 1 to 2 inches down. Or if the patient starts coughing, then you start withdrawing. Okay? Okay, Ms. Shapiro, now I'm going to go in and suction. So now I'm putting the catheter in. And I'm going about 1 to 2 inches down. She's going to start coughing. And when she does that, then I'm going to apply intermittent suction. At the same time, I'm twisting and I am withdrawing. No more than, and then she's going to replace the oxygen. It's going to hyperoxygenate the client. No more than 10 to 15 seconds going down, suctioning back out. And you have to allow the client time to recover and reoxygenate. Okay? Only applying suction as you are withdrawing, intermittent, and in a circular motion with the catheter. No more than 2 passes. So I'm going to allow her to come back. Her heart rate should come back down. Her pulse ox should come back up. And then I'm going to go for the second time. Thumb up. We're going to introduce the catheter. If she starts coughing or you go 1 to 2 inches down, then I'm going to apply intermittent suction. At the same time, I am doing circular motion, remove, and she's going to hyperoxygenate. I mentioned no more than 1 to 2 passes because that decreases the oxygenation under your client and you need to allow the client to recover from the suction. If there's more need to suction again, you must allow the client about 30 minutes to recover and to kind of settle down before you can go back and suction it again. The way you're going to discard of this material is to wrap it around into your glove, disconnect, put it back in here. Again, we do the same thing. We grab it inside, turn it all around, put it back into your other glove, wrap it over, put it on the red bag, okay? And then you'll wash your hands and you will stay in here and we'll evaluate the client again. You're going to evaluate big things that you need to remember. At the beginning, you want to have a baseline of vital signs and respiratory status. At the end, how are you going to know if you were effective? It's by repeating your assessment and reevaluating. So you will obtain another set of vital signs, blood pressure, heart rate, respiratory rate, and pulse ox. And then you're going to listen to her lungs again to ensure that that bronchi, those secretions were removed. If they're not, you want to make sure that you come back half an hour later to see if the client needs to have more suction. Remember, documentation is going to be your set of vitals at the beginning, how the patient overall condition was, any issues the patient had throughout the procedure, how many passes you went down, the characteristics of the sputum itself, color, consistency, amount, and so forth, and then your reassessment at the end. So this is how you perform a suction in a client with a tracheostomy. So now we're going to demonstrate the trach care and how do you clean and change the inner cannula. Like I mentioned before, at the beginning of your shift, most likely you're going to perform a trach suctioning and then you're going to do your trach care, and throughout the day you will be doing more trach suctioning. Or if this is fresh trach, probably you will do trach care every 8 hours at the beginning just to make sure that everything is nice and clean and you do an assessment of the stoma. So the same assessment techniques and assessment items that I mentioned before applies here. Since you already did the first suctioning of the day, then all those vitals that you already obtained will apply for this procedure. If you're coming to do it and you're not doing the suction, then you still have to do that assessment. You want to make sure that you listen to the lungs, that you take a set of vitals, that you assess all the respiratory status so you can have a baseline. You explain the procedure to the client, and you have all the things that we mentioned before apply here. So what I'm going to have here is just your trach care standard kit. This one in here, we'll still have a couple of things in this kit that we're not going to use, and I'm going to mention that when I open the packet. The institutions now I'm working on creating a more user-friendly packet where actually you only have there what you need rather than things that you don't need. Again, we mentioned about having the inner cannula, the extra inner cannula, and then to have your extra trach tube holder. This is one of the new inventions that really have created a lot of comfort on the client, because before we used straps like long strips of a material that strap and tie it on the side, and that was very uncomfortable for the client. Now with this one, they actually have some cushion in it, so it prevents the skin breakdown. Okay, so again, so you already did all your assessment on your client, and you will wash your hands, get ready to go. You have the red bag and you have everything that you need in there. You already open your packet to have your tube holder. You want to make sure that you open your packet and you have it ready to go for your inner cannula, and you have it right there. And then you're going to open your packet for your cleaning. I'm going to show you what's in here. So you see, you have a set of gloves. That's what we're going to use. Then you have a little towel for your client, so you will remove this. It has a shiny part down, so the patient will have it. If you have any spill or anything like that, then you'll have it in here for your client. Okay, right there. Okay, and then you're going to have a variety of things in here. You're going to have cotton tip applicators. You're going to have your split gauze, and I'm going to show it to you when I put my gloves on, and any other extra 4x4s to help you clean, and a reservoir in here for your saline. Okay, now I want to highlight a couple of things in here with regards to the sterility of this procedure. Before, when we used to have metal trachs or any other equipment, we actually will take the inner cannula out. In this reservoir right here with these little things, we'll be cleaning the inner cannula, rinse it in on this one, and then replace it. Now we don't have to do all that. We actually just replace the inner cannula like I mentioned before. So when I do the procedure, pay special attention to that. So when it comes to sterility, in the major item that you want to make sure that you maintain sterile is your inner cannula. This is what goes inside the patient's trach. So you want to make sure that you handle it in such a way that it's going to, it's not going to get contaminated. Okay, and just I will show you that when I want to make a point about when I reach over and grab the brush in the packet. I only did that for demonstration purposes. I wanted to show you what it looked like, but of course, once this packet is open, you don't want to reach in there with your bare hands. You want to make sure that you have your gloves on. So I'm going to pour my saline against everything works. So this one is already open, so I'll come back over here and lip it and clean it. And I'm just coming in and I'm just going to pour my saline into my reservoir. And I'm just going to step back and I'm going to replace the cap. And I'm going to put my gloves on. I'm ready to go. Okay, this one is going to be open already because this is the first thing I'm going to do. So I'm just going to open this, available to me. Okay, make sure that this is kind of open in here. Get my first glove, step back and put it on. And I got kind of cut, so I'll make sure that I have my thumb hitchhiking, and I'm just using my fingers underneath it. And now I can go ahead and fix it. So now I have my gloves on. I have it above my waist. This is my non-dominant hand. This is my dominant hand. So my assistant is going to remove the oxygen, and I'm going to grab the inner cannula with my non-dominant hand. And with my dominant hand, I am going to grab the new one. You see how I'm touching it? I'm just keeping it, just touching the outside of it with my gloves. And then as she removes it, I'm going to take the inner cannula out, and I am going to put the new one in without touching any corners. And I am going to push it in place, and I'm going to click it in place, and this goes into the red bag right here. So at this point, the patient has not have any break on oxygenation. I have maintained the sterility of the part that needs to be sterile, which is the inner cannula. At this point, it's a clean procedure because we're not going to be doing anything inside the patient's trach. We're only going to be cleaning around the site. So what I wanted to show you is that these are the things that we are not going to be using. So those are one of the things that we just move over to the side. We have the two cotton tip applicators that we're going to put right here into your water. You have the split gauze, and I wanted to talk a little bit about this. You want to make sure that you use the one that comes directly for that. You don't want to get a 4x4 and cut it in half, because that will create some filaments that can go inside the stoma and create issues for the client. So this is the one we're going to be using when we're done cleaning. And the 4x4s that you have extra in here, you can use it to help you dry and clean up. So we have this already in place. My assistant is going to help me.
So we can see your trach better.
There we go. So as she's just maintaining the oxygen source available to her, I'm actually looking at all her vitals and everything in there, so I'll make sure that she's doing okay. I will make sure that I hold the plate in place, and I am going to do a sweep motion, and I'm just going to clean all the crusties and everything that are under there, and make sure that we only use it once, and we keep it in here. The next one comes in here. We're going to the other side. So I'm holding it in place, and I'm just going to clean it, removing all the crusties, and make sure that everything is clean. If we need more, you will have more, and you can just go ahead and clean it and finish it. If you want to have any of the 4x4s to help you clean a little bit, you can do so. So you make sure that you just tap. You don't want to be rubbing back and forth. You just want to dab and remove. Okay? So at this point, the trach is clean. At the same time, you want to make sure that you assess the stoma. You want to make sure that if you see any blood or any little sores or anything like that, that you make a note of that so you can tell the physician when you are giving them report. So you want to make sure that it's nice and clean, and it's not red, it's not oozing, doesn't have any pus. And then we're going to now change the tube holder. For this, you want to make sure that you have it in such a way that it'll be easier for you to do. And you see that this has Velcro in it. So when you position it behind the patient, you want to make sure that you have it in the correct way. So I'll ask my assistant to kind of put it right underneath the patient. Okay. So we have both sides already in here. Another thing that you can use at this time is just to get your split gauze and have it available, so you can put it in there at the same time with changing the straps. You have an assistant that can help you. The main point in here is that you want to maintain that plate, that face plate in place, so the catheter is and the trach is not going to come out. So she's doing that, and I am just going to go ahead and remove this strap from here. I will go ahead and put this side of my gauze in place, and then I will replace this strap. And notice that she's keeping an eye on that, and then she's keeping that faceplate in place. Now this is going to be especially challenging if the patient has a fresh trach and it has sutures in place, so you want to make sure that you are very aware where the sutures are and that you're not putting pressure on them. Okay, I have this one right here. I can hold this in here, and I can remove the second strap, and she can remove that one from that side since I can't quite see it. And then I will put the other side of the gauze on this place, and then she will thread it through, and we'll do it and we'll put it in place. Now, The main thing that you want to remember when it comes to the straps, and you can do 2 snug fingers underneath or 1 loose one. You don't want it too loose, you don't want it too tight. Remember, even though it has some cushion in it, you want to make sure that you have some room in there for the patient to be comfortable. You want to make sure that you replace the oxygen source and the patient is comfortable. Replace the pillow. Check the balloon on the trach. It should be bouncy. Okay. You remove your gloves and you remove it this way. You make sure you have all your trash together so you can put into your red bag. And then you wash your hands. You leave your client in a comfortable position. You reassess them again to make sure that there was no differences in their assessment from the previous one. Make sure that they're comfortable, they have the cold light. Ask them if they need any help. Make sure that the bed is all the way down. And this is how you'll perform trach suctioning and trach care in a client.